a consultant in New Jersey, United States, is joining us. Dr. Obianwu is a professor, Department of Obstetrics and Gynecology at the Drexel University in Philadelphia, in Pennsylvania. Thank you so much, Dr. Chike Obianwu, for joining us.
Thank you very much, and good morning, Nigeria.
Right,
How are
good.
you guys?
It's great to have you with us, Dr. Obianwu.
Thank you very much. It's a pleasure to be here with you in this your wonderful presentation. I'm glad to be part of it.
Thank you so much. Yeah, many Nigerians have been inundated with figures of people in the U.S. Contracting this disease. In fact, the United States has the highest figure at the moment of confirmed cases and even of deaths, over 175,000 deaths as at this moment. You know, as much as I do, that very many Nigerians live in the United States. How safe are they?
Can you repeat your question to me, please?
I asked that very many Nigerians live in the United States, and with the alarming figures coming out of the U.S. on a daily basis, we are concerned about the safety of our compatriots in the U.S.
Absolutely, absolutely. Unfortunately, United States is one of the leading countries for the COVID-19 infectious disease transmission. You rightly said we have over 170 deaths, correct, in the United States at an alarming rate of 1,000 deaths a day. You can imagine uh, that could fill up one or two football stadiums every day. You also understand that we have almost about 5.6 million cases, uh, make it United States if about maybe 25% of the world population in terms of the death rate that we see here. Unfortunately, uh, this virus has been disproportionately affecting minority and African American population, and especially those in the front line and what we call essential workers. Our Nigerians, fortunately, um, are part of the mix of the American uh, community. And the best thing, that we can advise everybody is the five basic principles in terms of how to keep yourself safe. And you've heard many times um, talking about the five fundamental principles, which is basic hygiene, hand washing, sanitizing, masks, wearing your masks, social distancing, and avoiding crowds. And if you can do those simple basic things, there's no rocket science in this pandemic. We've had pandemics from time immemorial, from the 1800 pandemics to the biblical times, where in the Bible it says, close your door and remain in your house till the rat is over. So these five basic principles, and when you compare United States with most countries who have been stringent and adopted policies earlier to prevent or mitigate these circumstances, they have really come out ahead. Uh, so that is basically the basic uh, science to the mitigation and containment of this epidemic.
Dr. Obianwu, you recall that at the outbreak of this pandemic, the predictions that were made about Africa were very dark ones, for that matter. In fact, there were predictions that millions of people in Africa will be infected and would die. In fact, one of those predictions said dead bodies would be picked up on the streets of Africa and all of that. But 6 months down the line, that narrative seemed not to have come true. What exactly do you think happened? Because Europe and the Western countries that have top of the range medical facilities appear to have fared worse than Africa and, in fact, some parts of Asia.
Well, I think to all kudos to the African leadership. We have seen a slow pace in and a mitigation in terms of the control of the COVID disease. One thing, obviously, that makes sense is that when you have a lot of crowd is the basic thing that causes the propagation of this disease. But when African governments speak in uniform, when they prolong policies that help the community um, control or mitigate those simple measures, health, public health measures, we're going to find out that when you compare the United States with other countries, Asian countries, and all over the world, including, for example, New Zealand, those who have adapted these measures, whether it's African countries or American countries or other European countries, we have seen a very decrease in death tolls. We have seen a very decrease in the transmission of the virus. So I would say that in Nigeria, particularly, that the policies that they've enacted have done a substantial, great job in making us very progressive, and that those predictions were wrong, basically. Yes.
Do you think that the African countries, particularly Nigeria, can sustain the situation as it is now and even help in reducing the spread of this? And if it can, what must it do?
Well, as I said before, the basic thing is the rock science to the cure, not the cure, but the mitigation of this virus and slowing it down is the 5 basic principles of good hygiene. Good hygiene, good hygiene, good hygiene, hand washing, basic things that everybody, you don't need to be a millionaire or billionaire or to be one of the richest country to wash your hand. You wash your hand, keep good hygiene, you put on your masks, you sanitize, avoid social distancing, I beg your pardon, avoid crowds, social distance. I think will come ahead and Nigeria will be do very well, like in other countries that have been able to contain the virus.
Dr. Obianwu, let's talk a bit about possible vaccine for
Just
these
one,
for these
one second. Your audio
virus.
is very bad. Just 1 second. Can you repeat that question, please?
Yes, I said let's talk a bit about vaccine that is being developed in various parts of the world today. There are fears, there are concerns that they have even been expressed even by the Pope that there will be a disproportionate distribution of vaccine when it becomes available, especially to third world countries and particularly African countries.
All right. I believe I can repeat your question is how would they go about the distribution of vaccines, correct?
Correct.
All right, very good. The issue of vaccination is a moral, ethical dilemma. It's an issue that we know that there's no amount of vaccine that will help with this situation. The production of vaccine in the world will not be enough to vaccinate everybody worldwide. So it becomes a moral, ethical issue as to who gets the vaccinations, which country gets the vaccination. Is it the ones who have more money versus the ones who are poor? One thing you have to understand that this pandemic is a world pandemic, and in the distribution of vaccination, I think the World Health Organization has a lot of input on it, but you would find out that you need to vaccinate, especially those who are at risk of transmission. That is the most important thing. If you do not vaccinate or provide vaccination for those places that are at risk, the whole world will continue to be affected. So it's not a question about who has the money or who is able to buy it, but to look at where the risk and the is, and to vaccinate those population first.
Now,
So that would be the recommendation I believe that WHO would be going. There's enough, so, and the distribution, yes, the rich countries are going to get their own, but the point is that if you don't vaccinate where the problem is, it's a global, travel is a global economy. People move from one area to another, and those were all going to be affected unless you vaccinate where the risk is.
Now, be that as it may, Doctor, do you think that African leaders, African presidents and heads of state are doing enough at the moment to acquire these vaccines, these possible vaccines for their various countries when they become available?
Well, I'm not sure in terms of the dynamics of the politics, but what we know is that the vaccines are supposed to be hopefully made available on a free basis. WHO, we are in a world pandemic. It's not a question of if we start depending on leadership and finances, which country has finances, nobody will get vaccinated. So like the H1N1 flu that came about, these vaccines are made available. There are social networks that are in place by WHO and by other, first countries in terms of making sure that this vaccine reaches all the countries that are in need. So politics being aside, um, the WHO and the world community is making sure that the vaccine gets to everybody. It may not get to everybody, but that is where the moral ethical dilemma becomes to who gets vaccinated first.
That the human trial process is one issue that has been very controversial. And the argument in some places, in some quarters, is that some African countries have not made themselves or made their citizens available to participate in these trials. And maybe it's on that basis that they may get or may not get these vaccines when they become available.
I do not have that information, but what I know is that we have about 7 uh, phase 3 trials already in the world community that is going on. There is excellent work that was done in London, in United Kingdom, which they've made. They've already started their phase 3 trials on the humans. So the companies and the research community, the scientific community have done a lot of work in terms of bringing this vaccine. It takes long to produce a vaccine, but we have about 7 vaccines on phase 3 human trials, and hopefully, as the CDC and Dr. Fauci from the head of the infectious disease in the United States have said, these hopefully that we are optimistic that these vaccine will be made or be ready sometime before the end of the year.
All right, Dr. Obianwu, apparently Russia is the only country that has so far rolled out what he describes as a vaccine for this pandemic. Now, a lot has been said about its safety and its effectiveness. What are your thoughts?
Well, we don't have any information yet. We know that the Russian government have made that announcement. We're yet to see. One thing good about the scientific community, that we like to share information and look at the effectiveness and the research behind what is out there. We don't have that information yet. We just have recently, maybe a week or 2 ago, had that announcement made, and we're yet in the scientific community yet to see the paper trail and the research behind it. Yes.
Now, as an African and a Nigerian for that matter, there's been some controversy over the virus and malaria in Africa and all of that. What would be your thinking as far as the virus, the coronavirus and malaria is concerned?
Well, I'm going to leave it up to the infectious disease experts in terms of the relationship with malaria and the COVID-19 virus. I am not privy to speak on that aspect since that's not my area of expertise.
All right, thank you so much, Dr. Chike Obianwu, who joined us from the United States of America as the medical director and CEO of Alliance Consultants in New Jersey in the United States and professor, Department of Obstetrics and Gynecology, Drexel University in Philadelphia, Pennsylvania. Thank you so much for your time.
Thank you for having me, and I hope you guys will have a wonderful day and stay safe. Please make sure that you guys keep the 5 basic principles and fundamentals in making sure that everybody is safe. Good hand washing, good hygiene, wear your mask, avoid crowds and social distancing, and hopefully this whole thing the rat will come to pass. Thank you very much.
Thank you so much, Dr. Chike Obianwu. All right, let's wrap up our program for this Sunday.